Start just like we did in the right upper quadrant view, finding stable structures that we know are there, like the kidneys and the liver. We then drag the probe anteriorly across the lower chest wall of rib cage, peering at the liver and using it as a window for the saccular structure on its underside that is the gallbladder. This is the normal appearance of teardrop-shaped structure with the liver superficial to it. Stones are prevalent in 10 to 25% of the population depending on age, gender, and ethnicity. The vast majority of these stones are clinically silent and don't cause problems. They look like this. They are either spherical or ovoid, and they are bright and hyperechoic in their appearance with shadowing tails behind them. When the gallbladder becomes diseased, the most feared is an obstruction or infection caused by overgrowth of normal bacteria called cholecystitis. Characteristically, patients have pain as the gallbladder wall gets thickened from white blood cells congregating and trying to isolate the infection. This causes fluid leak and edema around the gallbladder wall. Sometimes this fluid leaks out into slivers of black around the gallbladder. This is called pericholecystic fluid. Stones are often seen, but not always, as they may be up further in the pipes causing the obstruction. Gallbladder stones and infection are difficult to pinpoint. Oftentimes they do not present as normal infections. They do not have fever, and about half do not have the classic exam findings of a Murphy sign or right upper quadrant pain over the gallbladder. Additionally, white blood cell counts are the last refuge of the intellectually destitute and are normal in up to 60% of cases. The only reliable test is ultrasound, which you're going to be called on more and more to do yourself as sonographers, and radiology ultrasounds are usually limited at most hospitals around the country after banker's hours, on weekends and holidays, which is when patients are likely to show up with pain. Ultrasound is a tool you can use, and oftentimes better than your physical exam, but it's a tool that has to be applied by a savvy clinician who knows their own limitations and that of their equipment and testing. See you in lab. Don't forget the pre-lab quizzes. Take a look at the ebooks and videos for additional information, and see you in lab.